The primary objective of every surgical energy device is to elevate the temperature of the target tissues, either to produce division or sealing. In this module, we're going to take a dive into the repercussions of different temperatures on tissues regardless of the energy source that is employed to generate them. This discussion holds relevance across all forms of surgical energy. Our body's normal temperature rests at 37 degrees Celsius. If we increase tissue temperatures to 50 degrees, immediate effects may not be apparent. However, maintaining this temperature for 6 minutes or longer induces irreversible cell death. At this point, cells lose all function, their membrane becomes permeable, allowing protein-rich fluid to escape, and the cells shrink in size. Though the tissue effect at this temperature may not seem overly dramatic, the loss of function or cell death is irreversible. A fractional increase in temperature to 60 degrees results in instantaneous cell death without the need for prolonged exposure. The tissue effects remain consistent with the earlier description. As we push temperatures beyond 60 degrees up to 90 degrees, tightly curled protein molecules within cells unfold, exposing reactive segments to other protein molecules. Upon cooling, these reactive segments adhere in random ways, forming a continuous interlinked mass, an occurrence known as protein coagulation or denaturation. This process mirrors what happens when a raw egg is cooked, transforming its runny proteins into a fixed shape. Continuing to raise temperatures towards the boiling point of water causes water vapor in cells to escape dramatically, creating a plume of steam. This sudden release leads to instantaneous cell lysis, imparting a cutting effect within tissues. Continued application of heat would cause more water to escape, causing drying or desiccation of tissues. Further escalation of temperatures prompts the oxidation of proteins and carbohydrates, resulting in a black eschar. Similar to leaving food on the stove for too long, the fluid escapes as steam and the remaining material burns, forming a sticky black layer. Think of the accumulation we observe on the tips of our energy devices during surgery. Applying these principles to comprehend how a vessel is sealed with heat, the initial step always involves using a device like forceps, bipolar devices, or harmonic shears to clamp vessels. This action, termed coaptation, brings the intima of one side of the vessel in contact with the opposite side. Coaptation or compression also halts blood flow within the lumen, preventing a heat sink effect that would otherwise cool the area. When heat is generated within the compressed vessel, cell death occurs, causing the leakage of protein-rich fluid. Upon cooling, a sticky protein coagulum forms, sealing both sides of the intima, achieving hemostasis, even after the forceps compression is withdrawn. In essence, the three critical controllable factors for effective vessel sealing are compression of the vessel, the introduction of heat, and allowance of time for the sealing process to occur. To summarize, surgical energy devices aim to elevate tissue temperatures for division or sealing. Temperatures beyond 60 degrees induce instant cell death and protein coagulation. A division or cutting effect is seen at 100 degrees, while higher temperatures cause the denatured tissues to oxidize, producing a sticky eschar. Compression with devices like forceps coapts the vessel, preventing a heat sink effect. Heat generation leads to cell death, and upon cooling, a sticky protein coagulum forms, achieving hemostasis. Effective vessel sealing requires vessel compression, heat introduction, and sufficient time for the sealing process.